Hello and welcome to our WIFR Fastcast. I'm Daniel Burbank from the WIFR News Now desk. The Rock County Medical Examiner's Office identifies two people who were killed in a two-vehicle crash Sunday morning. Investigators say 68-year-old Barney Hurd and 43-year-old Carlos Hodges collided with each other in the area of Cranston Road and Prairie Avenue. Hurd died at the scene and Hodges died at a local hospital. Two Monroe families look for a new home after a fire destroyed a garage. According to the fire chief, crews were called before 11:30 Tuesday night to an alley behind 17th Avenue. First responders saw a large two-story garage in flames near a middle school. The fire was put out. No one was hurt. Leaders say they thanked a neighbor who called in the fire. U.S. Education Secretary Linda McMahon is expected to visit the state line Thursday. This is part of a History Rocks event happening at the Genoa Kingston High School. The tour is organized by the Education Department in collaboration with Turning Point USA. Leadership with Genoa Kingston School District say the event is only open to students and their families, and attendance is optional. We will have full coverage throughout the day, on that day, on the WIFR app and on air. Well, President Donald Trump's border czar Tom Homan says 700 federal troops will leave Minneapolis. This comes after immigration officers fatally shot two American citizens last month. Democrat lawmakers demand dramatic reforms to ICE before they agree to fund the Department of Homeland Security for a full year. Republicans push for a crackdown on sanctuary cities. Homan says his goal is to complete drawdown if certain conditions are met.
That is largely contingent upon the end of the illegal and threatening activities against ICE and its federal partners that we're seeing in the community. We'll draw down 700 people effective today.
The Northwest Illinois Area Agency on Aging changes its plan to create a new senior center in Rockford. WIFR's Nathaniel Langley speaks to an agency and a city official on what's next. Nathaniel?
Hey folks, WIFR's Nathaniel Langley here in front of what could be Rockford's first senior center in more than a decade. But this building right here is not the one Rockford City Council approved the other night. This one, if the deal goes through, is actually going to require a whole nother voting process. Be sure to tune in later today on WIFR and catch it on WIFR.com as we unpack what happened and what's next.
Nathaniel, thank you. And Wednesday marks World Cancer Day, which is a time to reflect progress against one of the world's deadliest diseases. WIFR's Jake Pearson speaks with Dr. Iftikhar Ahmed with OSF Healthcare on the importance of this day.
World Cancer Day.
So World Cancer Day is newer by it's about 26 years old. So it was an international day created in the first one was February 4, 2000, and it was established at the World Cancer Summit Against Cancer for the New Millennium. So the millennium kind of is what prompted that. And it's led by an international organization called Union for International Cancer Control. And the goal of it was to raise awareness for cancer, to encourage prevention, to encourage detection, and also to bring attention to treatment and research that can be done to improve treatment around the world.
Yeah, absolutely. And then I'm not sure. I don't know if I caught a year, but when did it start?
2000. So the first one was February 4th, 2000.
Gotcha. All right, perfect. And then I suppose obviously it kind of differs for men and for women, but could you just talk broadly about the types of cancers that are kind of the most deadly out there?
So in the United States, the deadliest cancer for both male and females is lung cancer. And that's been number one for quite a few decades. Second is then colon cancer, again, in both men and women. And then third for women is breast cancer. And third for men is prostate cancer.
Mm-hmm. All right. And then obviously, when it comes to progress on getting a cure, where are we kind of, I suppose, looking at in that? I know obviously something like that hasn't come out yet. And I know actually you and I just week or two ago talked about, I want to say it's the 5-year survival rate,
That's correct. I was
70%.
just about to
So
say, I'm like, you're asking
yeah,
me the question you have the answer to.
I
No,
know.
no, that's good. There's some continuity. I like that.
Mhm.
But certainly there's not an all cure for for all cancers. Cure is something that we hope to achieve one day. I kind of uh, jokingly tell my friends and family that I'd love to be out of a job. And I say it as a joke, but it's serious, right? If there came a time when there was no more cancer and I had to do something else, I would be very thankful for that, because it is a disease that really affects a lot of people in so many different ways. So, um, as you mentioned, the survival rate for cancers, the 5-year survival rate just very recently was found to be 70%, which is a significant increase than even what it was about 20 years ago. So the reasoning, or what do we attribute that to? We attribute that to better treatments, specifically, more tailored treatments to the type of cancer you have. So it's not just treating kind of a shotgun approach, but it's very focused. It's very, like I said, tailored. There's a lot of immunotherapies that are very specific to the type of cancer one individual has. So in this day and age, there are situations where two people might have the same stage of cancer, but may be getting different treatments based on the genetic or the makeup, the microscopic makeup of their cancers or the
Mhm.
specific cancer cells, what receptors it's you know uh, uh, susceptible to, and things like that. So that's one big thing. Prevention is another key. By prevention, it's also screening. So the cancers that we're finding them sooner, and the majority of the cancers, the earlier stage you find, the higher chance there is for your cure. So women are getting their mammograms on time. Men and women are getting their colonoscopies on time. There's a lot of research being done on screening for lung cancer. So lung cancer being the deadliest cancer, I think the most inroads have been made with lung cancer, and that the screening for lung cancer has been actually found to be quite effective. And despite a lot of promotion of lung cancer screening, it's only used in about 20% of patients who really need it. And part of that is people not knowing about it. Part of that is people not necessarily wanting to get the scan or not wanting to know. And then the third part is smoking. The percentage of people in the United States that smoke is, I think, around 10 or 11%, which, again, significant decrease compared to 20, 30 years ago. And we know that smoking is responsible for 95% of lung cancer, and also contributes to many other cancers. So the fact that the smoking rate has significantly decreased, we're just seeing some of the fruits of that now, and God willing, in the next 20, 30 years.
Mhm. Yeah, and then one more quick question here for you. Obviously, I think maybe some folks would say like, "Oh, World Cancer Day," it almost kind of makes it sound positive type of a thing. But why is a day like today important? To be symbolized as World Cancer Day.
Well, I think there's a couple of reasons for that. One, as I mentioned before, cancer being so deadly, but from a world stage, I think that it's important for us, especially in a more developed country with a lot of resources, to realize that the advances we've made here, unfortunately, aren't available throughout the world. There's countries where the mortality rates for early stage cancers are high because they don't have the ability to treat them. And then there's other countries where cancers are being caught much later, so obviously the outcomes are less. So one of the reasons they say it's World Cancer Day is you want to look at everything. And actually, the theme several years ago for World Cancer Day was close the gap. And close the gap meaning that let's make sure that there's not such a difference in access to cancer services, in throughout the world, across incomes, ages, ethnicities, and things like that. So I think there's definitely a reason to think about it on a global scale.
All right, and then yeah, any last questions or any last things you'd like to add, or any last points you'd like to mention?
No, I think again, when it comes to cancer, catching it early is the key. Until we have a cure, or a one-all shot that can just prevent it like a vaccine almost. The best thing to do is to make sure you're getting regular checkups by your primary care provider, that you're doing the screenings that are recommended, because the cancers that are caught early have a significantly higher chance of being cured.
Well, downtown Rockton transforms into a winter wonderland as a 4-day Yeti Fest officially kicks off on Wednesday. Residents can enjoy several events like snow sculpting, scavenger hunts, and a brand new treat trail. Guests are also encouraged to keep a close eye on the roaming Yeti throughout the village. We'll be live there at a look at the 4-day festival. Those stories and more are coming up on the shows at this evening and this afternoon. Make sure to download our WIFR app on Amazon, Roku, and Apple TV. Thank you so much.